primary care is the best way to prevent somebody from even reaching those other specialties because they would be healthy. They would live longer and happier lives. My name is Arturo. I am 29 years old and I live in Seattle, Washington. I am first generation born in the US of immigrant parents and identify with the Latinx Chicano community. Yes, I do have a primary care doctor. At my age, you don't see them as often. Um, I think it's important just to establish care at a primary care facility and get to know your doctor, even if that is one visit, because once you are established in care, then it's easier to get care when you need it, because sometimes you just don't know what's going to come up. I have a lot of skin issues and sensitivities and things like that. Usually if I go to my general primary care doctor, it's not just about the skin, it's also just looking at my general health, asking how I am. And nowadays too, they're asking, a lot of doctors are asking about mental health because a lot of things come up because of stress. So it's really more of a wider holistic ask when going to a primary care doctor versus I've been working for the last 8 years in community. I'm in partnership with community for a local human service nonprofit called Neighborhood House, and really been representing and advocating for the health and well-being of immigrant, refugee, and low-income communities here in all of Seattle and South King County to get access to care, housing, education, and economic opportunities. I'm here to serve the people and make sure that they have access to health, education, housing, and economic opportunity. And we frequently talk about these social determinants of health that keep people from getting access to care. And for communities, our communities, whether immigrant, refugee, or people of color, low income, like they see primary care providers or doctors as like these are the people that we look up to make sure that we stay healthy ourselves, our families, our kids. And this is where it's important that primary care centers community at the forefront of everything that they're doing. However, it hasn't always been great, I will say, because sometimes we do feel like the primary care setting doesn't center the community, and someone may have an experience from their own country knowing their own health the best and working with their primary care doctor there, and then they come here and they're like they try to give their input or try to share with them some health history that's mattered to them, and primary care doctors may not listen. Same thing with culture. There's a lot of culture that needs to be understood. So we here at our agency really believe in hiring from the community, and our staff represent the community and have those same shared experiences. And that's one thing, I also hope to see within primary care is, having more community members become part of the primary care team so we can help kind of integrate that health and I think people would get more invested into primary care with the impact, knowing the story, being inspired to be part of the movement that gets communities healthier. So centering those voices, and that only gets a person so far to start sometimes. And I don't know how that data is shown, but that's where also you listen to the students or those primary care providers of like what is missing, what would keep you here. And if I have heard a lot of my friends that are graduating and going to their residencies, when I talk to about primary care, they're like, well, it doesn't pay that much. I have huge loans to pay off and all of this. And so yeah, it does feel and sound like the value isn't there as much for primary care providers. I think, that's where we must figure out how to get these primary care roles to help people that do want to be in the preventative care area and make sure that the well-being of community is the end goal, because a lot of people that go into primary care or into the medical field do want to have people be healthier. And that is out there of like that primary care is the best way to prevent somebody from even reaching those other specialties where, if we would have focused on their health at first, it wouldn't even need all these specialties because they would be healthy. They would live longer and happier lives. So it's just here that we see that value does not exist the same as in other countries where we're learning from others that, they don't necessarily have to have all of that specialty because people really do care for their health and prevent them from getting to that specialist, which is so important. This message is to everyone is just, what's important is again centering the communities that have been marginalized and that need the most support. But those patients are people. Those people become the primary care providers. Those are still people and patients. So centering them, and not forgetting about our immigrant, refugee, and people of color community members that have not been as invited and involved in primary care is really important.